Hi everyone. It's been 2 months since I was put in general surgery, and I think I just want to come up with a little chat with everyone of how it's going and what I have done during the past 2 months. Um, in my school had set up for this 12 weeks, as I mentioned in my previous videos, 12 weeks of surgery core rotations, and for me. I had done a floor service for general surgery, and I had done two subspecialties, which I follow a doctor that specialized in plastic surgery and hand surgery. And I also follow another doctor who's specialized in head, shoulder, and elbow orthopedic surgeries. This 2 months has passed by so quickly. I spend most of my time at a hospital or at a doctor's office, and very little time at home. Try to utilize as much the time to study, but I do wish that I have some more time to read, and so I can actually read into textbooks and everything. Overall, the experience is very fast-paced. As subspecialty goes, it's really physician dependent of how they want to run their service and how they want to run their office. I follow a physician that's really quiet and doesn't talk much, but he does teach at points that were very necessary, or details of the procedure and what are the tricks in doing such surgery. I found very entertaining, and sometimes it's just a different style. And on the other hand, I have another surgeon who's very talkative and explains everything that he does, and sort of ask questions as it goes, and train you for how to interview patient with the problems. Out of both, I actually extract a lot from both of them, whether it's their practice style or how they attend to patients and how they approach the patient's problem and how they write notes. It's very interesting to see all different styles and all different approach, how they practice their medicine, and sort of give me an idea of what and how I'm going to do when one day I'm licensed. As far as the general surgery goes, it was a little bit tiring at first. You wake up at 4 or 5 a.m. and try to get to the hospital by 5:30, 5:45. Write down the patient's vital, lab if they came back from last night, images or anything that you can find that's related to the current condition, which in general surgery mostly, GI problems, some overnight observation for falls, fractures, and not major life-threatening issues as my service is, but I guess the service will vary, but the routine's the same. Get there before your resident, get there before you're attending, of course, and prep with your residents, and then ready for the attending. And that's pretty much the day-to-day practice. Luckily, I live only 10 minutes away, so I mean, for you out there, if you have a choice, I think it's important to live somewhere close by, since sometimes you can be late, or they can text you and say, hey, there's an opportunity for you to be in this surgery, come over right now. And there were several occasions that I rushed to the hospital. I would also like to talk a little bit about how I approach my study. Well, I haven't taken my shelf yet, so I don't know how this is gonna work, but I'm doing my MD&E practice shelf, which shows some good results. So I figure, I would discuss a little bit about how I study. Usually what I do is I use like short clips, introductory videos like online med ed, or some other things I can find on YouTube. Try to just get an understanding, a grip of what the topic is related to and what's happening and what's important. And then I do deeper researches on up to date, and I use a book called Dr. Pastana's Notes. It's a very short review. The day before I'm going to see the procedure, or I'm going to see the particular service. And then as far as practice question goes, it's U-World. 200 questions in general surgery about not a lot of questions, so I mean, I am not finished yet. I just want to sort of make sure that I understand everything and sort of have a first-hand information first before I jump into questions. I just don't want to waste them. I do somehow wish that, you know, I have more time to read textbooks and read into more details of what's going on. That is sort of impossible right now since my work hours are a little crazy, spending 9-12 hours outside and come home being very tired. It just doesn't, I just don't find as much time. However, as far as life goes, I did a little bit of fix up on my basement. I will also show you guys on this video. And then my siblings visited last weekend, and they brought another member of my family here, and they left it with me. My siblings brought me her, Mori, the newest member of my family. She's a year and a half. And she was staying with my parents, but now she's over here in the United States. And my siblings left her with me, so she can play with the two. Wasabi is currently sleeping, and Sashimi is right here, being a little jealous. But all three of them are doing very well. And the next thing I want to show you guys is what I have done to my basement. So if you can follow me, let's go. This is my basement. And as you can see at the wall, there are some damages with the paint. So the paint basically peeled off, and this is a very common basement problem. I sort of looked up various sources, and including YouTube, of course, on how to fix these. And I actually found that you can buy these instant cement from Home Depot, and then you can also buy these waterproof paint from Home Depot. And so I'm just kind of sort of showing you guys how I patched this up. It's the instant cement that I mentioned earlier, which is a very small amount that you need, and a small amount of water as well. Pretty much all you do is just sort of mix the cement up and then put it on the wall. It dries in about 10 minutes. As you're applying, just make sure that you cover all the little gaps. And now I also decided to do a laundry room makeover. This is the original laundry room with some holes and cracks on the wall as well. Same problem with the basement foundation. We're gonna put that quick dry cement, and then we'll put the waterproof paint on it, so make sure there's no water leakage and whatsoever. So not long after I applied the cement is dry as you can see, and then I just applied that waterproof paint over. You know, again, remember to put double paint, double layers on the crack and anywhere that you think water can seep through. And this is back to where we first started, and then the laundry room also is done. Now I'm going to put some flooring. These are just very easy stick-on floorings that you do have to apply glue and clean up the floor, prep the floor, and then measure the size and all. But it's relatively easy to put on. So after the flooring, I add on some baseboards, and these are just very easy metal pieces that you kind of saw it off with a hex saw. They're all around the corner, and after this I'm going to paint and change a little bit of light and get new laundry machine. So this is the finished project. I got new laundry machines, and this is how the floor is done, and the new lights, and I also painted the ceiling black. I just sort of think that would look nice, this little industrial feeling. and then I put in door frames and a new light switch. Yeah, that's pretty much it. I will see you next time.